Chair, and thank you for having this hearing, Senator Klobuchar and Ranking Member Lee, on this really profoundly important topic that literally touches every American's lives. I want to focus for the moment on private equity deals and their impact on quality of care and the financial incentives that go into healthcare decisions regarding financing and economics. Private equity deals in healthcare, including hospitals, have nearly tripled over the past decade, up from $41 billion in 2010 to $120 billion in 2019. The total over the last 10 years has been $750 billion of private equity going into about 100 hospital deals in the last 3 years alone. Consolidation is a core part of the private equity business model through roll-up and buy and build strategies. Loans finance the vast majority of the $750 billion spent on private equity healthcare during the last decade. Those deals mean that the private equity funds, the ones who engage and control, are not on the hook for the loans. Instead, private equity funds structure the deals so that the acquired healthcare providers are responsible for repaying the debt that the private equity funds used to purchase them. This structure has far-reaching, dramatic, profound consequences for our healthcare system. Large hospital chains under private equity management have been forced to sell off and close hospitals to meet their debt burden. The incentives and self-interest of the private equity funds drive the finances rather than respect and care for the patients who are there or the professional staff who assure quality care. Let me ask you, Professor Gaynor, how significant of a role does the burdening of hospitals with debt play in the closure of hospitals or the need for hospitals to merge with larger systems to stay afloat? In other words, the consolidation of healthcare.
Senator Blumenthal, thank you for the question. Let me mention actually a report that was just released the other day by Laura Alexander of the American Antitrust Institute and Richard Scheffler at University of California, Berkeley, that goes into a lot of detail on some of these things. I'd say that there is real concern about the role and the impact of private equity in healthcare, exactly as you indicated, because the model is to come in, take over an underperforming firm, turn things around, at least on certain balance sheets quickly, and then sell it for a profit. So private equity investors are not in that for the long term. That can work in some circumstances, but healthcare is quite a different matter. That's one. I don't think we know at this point the extent to which private equity has played a role in consolidation. That's something I think we need to know more about. And moreover, I'd add to that we need to know more about the behavior of private equity owned firms. There's evidence that suggests that private equity firms, not surprisingly, are hyper responsive to the competitive environment. So if the market is competitive, they will be very aggressive. But if it's less competitive, they will take every advantage of profit opportunities, more so even than typical investor-owned firms. So I think it's an important issue. Thank you.
Thank you. That's an excellent answer. And I might just say that my question is in part based on that study by the American Antitrust Institute. But really the point of the question is we need to know much more about the real-life impacts of these private equity deals. Their incentives are not aligned with patient care. In fact, not aligned with necessarily professional care. The private equity companies don't want to run these hospitals long term. Often their business model is to buy the hospitals, consolidate them, merge them, and then sell the resulting entities at a profit. The private equity model generates short-term revenue. It has long-term consequences for patients, often at the expense of the viability of the hospital. And I'll just give you one example. Private equity companies have been known to buy hospitals only to sell off their underlying real estate, the basic real estate that underlies the hospitals, forcing the hospital to lease back their own facilities. From real estate investment trusts and leaving the hospitals financially vulnerable. A particularly egregious case of a private equity company stripping a hospital of its real estate is that of the Hahnemann University Hospital in Philadelphia, which was purchased in 2018 by Paladin Healthcare, a private equity fund. The company invested no money, none, in improving the hospital and shut it down 18 months later with a plan to sell the real estate in a rapidly gentrifying neighborhood and leaving the neighborhood without a key healthcare provider. So my point is that these private equity investments in healthcare markets have gone unchecked and unreviewed for far too long in staggering numbers with absolutely profoundly important consequences. And I strongly believe that Congress needs to study this relationship as you suggested. I, again, thank the chair for focusing on this issue as a matter of antitrust law, but it's also fundamental healthcare interests as well that are at stake. Thank you, Madam Chair.
Thank you very much.